AI is rapidly reshaping healthcare, and there's no question that it brings powerful advantages. Algorithms can scan medical images at remarkable speed, flag early signs of disease, organize patient data, and help clinicians manage overwhelming workloads. In diagnostics, AI can catch subtle abnormalities in scans that even trained specialists might miss. In triage, it can help prioritize urgent cases before a human even opens the chart. For patient support, AI can explain test results in plain language, guide people through medication reminders, and offer around-the-clock access to basic health information. These tools, when used wisely, can make care faster, more efficient, and more accessible, especially in overburdened systems where doctors simply can't spend as much time with each patient as they'd like. There is real, meaningful promise in using AI as a supplement that strengthens human healthcare teams. But that promise is inseparable from significant risks, and the most dangerous of them comes from assuming AI can replace clinicians rather than support them. Even the most advanced systems operate on patterns, not understanding. They predict outcomes based on past data, but they don't grasp the context, lived experience, or ethical considerations that guide medical decisions. When people imagine a future where AI provides diagnoses, recommends treatments, or manages patient care independently, they underestimate how much medicine relies on human judgment, judgment shaped by experience, intuition, and the ability to interpret nuance. AI can misread symptoms, misunderstand ambiguous descriptions, or overlook rare conditions simply because they appear less often in training data. If a model has blind spots because its data is biased, incomplete, or unrepresentative, it can reinforce health disparities rather than reduce them. Real-world examples already show AI misclassifying skin conditions on darker skin tones, underestimating pain in certain populations, and producing inaccurate risk scores that harm vulnerable groups. If healthcare systems rely too heavily on these tools, patients could face misdiagnosis, delayed treatment, or incorrect medication recommendations. The more we automate, the more dangerous these errors become. There's also the issue of false confidence. AI often presents its outputs with certainty, even when it's wrong. A doctor can recognize when they're unsure and seek a second opinion. A machine cannot. If clinicians start relying on AI recommendations without critically evaluating them, their own diagnostic skills may erode. Over time, the human workforce could become overly dependent on automated systems, making the entire healthcare structure more fragile. Once clinicians lose the habit of questioning and re-examining, the quality of care can quietly decline, leaving both patients and professionals more vulnerable. Another serious concern involves responsibility and accountability. When a clinician makes a mistake, there are systems in place to protect patients and address the error. But when an AI model contributes to harm, accountability becomes murkier. Who is responsible? The developer, the hospital, the algorithm itself. Without clear regulation and oversight, patients may find themselves trapped in a system where harm can occur without anyone directly answerable for it. Medicine cannot function safely without clear ethical boundaries, and those boundaries become more complicated when AI is deeply embedded in the decision-making process. Privacy risks only add another layer. Healthcare data is deeply personal, and many AI tools rely on enormous datasets to function effectively. If those systems store or share data in unsecured ways, sensitive medical information could easily be exposed. In a world where data breaches are common, tying AI deeply into healthcare creates vulnerabilities that could follow patients for life. Yet despite these warnings, the future is not bleak. There is a promising path where AI plays a vital role, not as a replacement, but as an assistant that strengthens human care. AI can reduce administrative burdens, allowing clinicians to spend more time listening to patients. It can identify patterns across populations that humans might overlook, improving public health planning. It can fill gaps in rural or underserved areas, offering preliminary screening until a specialist becomes available. Used responsibly, AI can help doctors work more accurately, more efficiently, and with less burnout. The key is resisting the temptation to hand over too much power. Medicine needs human intuition, ethical reasoning, emotional intelligence, and the capacity to understand suffering, qualities algorithms cannot replicate. AI can extend the reach of healthcare, but only humans can anchor it in compassion, accountability, and wisdom. The future of AI in healthcare will be safest and most effective when the technology remains what it is meant to be, a tool that enhances human care, not a substitute that tries to replace it.